젠장 또 중용이야. 난 중용을 해야만 해.
한 2년 전쯤 또진 똑똑.
everyone. It's my pleasure to be here. My name is Matana Prumipapat or May.
The story of correlation between physical task performance and
The event will begin shortly. Please wait a moment. For smooth proceedings, please write your name and affiliated organization next to your YouTube ID. The 2024 Korean Society of Integrative Medicine International Conference is now scheduled to be held. Everyone, please pay attention.
안녕하십니까. 먼저 바쁘신 와중에도 2024년 대한통역회 국제학술대회에 참가해 주셔서 대단히 감사드립니다. 저는 이번 대회의 사회를 맡은 대한통역회 총무이사 주영기입니다. 이번 2024년 대한통역회 국제학술대회는 AI와 보건의료 서비스, 접근성과 효율성의 새로운 패러다임이라는 주제로 개최되며 모든 과정은 유튜브를 통해 진행됩니다. 또한 원활한 진행을 위해 유튜브 댓글창 본인 아이디 옆에 성함과 소속 기관을 기재해 주시면 감사하겠습니다. 개최에 앞서 이번 대회에 함께해 주신 주요 인사분들에 대한 소개 후 별도의 코멘트 없이 대회를 바로 시작하도록 하겠습니다. 감사합니다.
Hello. First of all, thank you very much for participating in the 2024 Korean Society of Integrative Medicine International Conference despite your busy schedule. I am Yoon Ki-chu, the Secretary General of the Korean Society of Integrative Medicine, and I will be hosting this conference. The 2024 Korean Society of Integrative Medicine International Conference will be held under the theme, AI and Healthcare Services. A new paradigm of accessibility and efficiency, and all proceedings will be conducted via YouTube. For smooth operation, we would appreciate it if you could write your name and affiliated institution next to your YouTube ID in the comment section. Before we begin, I will introduce the key personnel participating in this conference, and then we will start the event without further comments. Thank you. Chairpersons, Taehyung Yoon Dongso University, Korea. Vice Chairpersons, Control Lee Kyungnam College of Information and Technology, Korea. Myungchul Kim Yulji University, Korea. Taeyoung Osilla University, Korea. Morishita Motoyoshi Reiwa Health Sciences University, Japan. Matana Bumiprafat Narisuan University, Thailand. Secretary General, Chul Jang Kyungnam College of Information and Technology, Korea. Youngki Chu Gupasungshim Hospital, Korea. Communications Consultant, Byungkwan Lee Kanyang University, Korea. Junghyun Kong Jongnam Jeoching University, Korea. Morteze Marsden Bonn University, Germany. Mungtuya Inkbayer Mongolian National University, Mongolia. Odgensen Ochirbad Mongolian National University, Mongolia. Dear members of the Korean Society of Integrative Medicine KSIM and members from around the world, greetings to you all. It is my great pleasure to extend a warm welcome to all members of the KSIM who are participating in the 2024 International Conference, hosted by the Korean Society of Integrative Medicine. The 2024 International Conference, themed A New Paradigm of Accessibility and Efficiency in AI and Healthcare Services, will be held online. and will feature thematic presentations, oral presentations, and poster sessions utilizing video content. AI technology has been enhancing the quality of healthcare services in various ways, reducing medical costs, and having a positive impact on both patients and medical professionals. Firstly, AI facilitates the implementation of telemedicine, providing high-quality diagnosis and treatment without geographical limitations, thereby expanding the accessibility of optimal healthcare services. Secondly, AI rapidly and accurately analyzes vast amounts of medical data, enabling medical professionals to make faster and more precise decisions, thus improving the efficiency of diagnosis and treatment while saving time and costs. Additionally, AI-powered patient management automation monitors and tracks patient symptoms, ensuring timely medical intervention. In this way, AI will continue to develop predictive models, making significant progress in disease prevention and predictive treatment, driving continuous advancement in the healthcare industry, and fostering a new paradigm. Furthermore, it will improve the management and operational efficiency of the medical supply chain, enabling quicker and more cost-effective healthcare services. I would like to extend my sincere gratitude to all KSIM members and participants from Germany, Japan, Thailand, Mongolia, and other countries for their active participation in the 2024 International Conference and for presenting numerous valuable papers. With the growing interest in not only therapeutic approaches to diseases, but also in health promotion and leading healthy lives, the importance of integrative medicine is increasingly emphasized. I hope that this year's KSIM International Conference will contribute to transforming and advancing the paradigm of accessibility and efficiency in AI and healthcare services, and serve as a platform for sharing new information in the medical field. I believe that the 2024 International Conference will become an invaluable and meaningful academic gathering, fostering the academic development of all members. It will be an excellent opportunity to exchange information and experiences and to explore new concepts in integrative medicine. The Board of the Korean Society of Integrative Medicine promises to support the academic success of all our members to the best of our abilities. And I wish all attendees of the 2024 International Conference health, happiness, and continued success. Thank you.
Dear guests, colleagues, and participants, it is my great pleasure and honor to welcome to you to the 2024 Korean Society of Integrative Medicine's International Conference, centered on the theme AI and Healthcare Services, a new paradigm of accessibility and efficiency. As we gather here today, we stand at the forefront of a transformative era in healthcare, where the integration and artificial intelligence is reshaping the landscape of medical services and patient care. AI is no longer a distant concept, but a reality that offers unprecedented opportunities to enhance healthcare delivery, improve outcome, and broaden accessibility for populations around the world. By embracing these advancements, we can foster more efficient, personalized, and accessible healthcare services, ultimately ensuring that no one is left behind in receiving quality care. This conference aimed to serve as a platform for experts, researchers, and practitioners to engage in meaningful discussion, share innovative findings, and explore the diverse applications of AI in the medical field. Through our collective knowledge and collaborations, we can address the challenges, hardness, the potential of the new paradigm, and shape a future where AI-driven healthcare systems are more inclusive, effective, and sustainable. I would like to extend my heartfelt gratitude to all speakers, participants, and organizers who had contributed to the success of the event. Your dedication and insights are invaluable in paving the way for the future where healthcare is accessible and efficient for all. Once again, welcome to the 2024 Korean Society of Integrative Medicine's International Conference. I look forward to fruitful discussion and exchanges that will inspire the next generation of innovation in healthcare. Thank you.
Hello, I'm Morishita Motoyoshi from Reiwa Health Sciences University, Japan. It is a pleasure to present from my presentation the role of rehabilitation therapies in dysphagia treatment in Japan. Rehabilitation of dysphagia is mainly handled by occupational therapists in Korea. In Japan, however, speech-language hearing therapists are often in central charge. Speech-language hearing therapists are not the only ones who provide rehabilitation for dysphagia. A multidisciplinary approach is needed. This may also be true in Korea. For example, physical therapists train posture for eating, and occupational therapists practice eating movement. Oral care by dental hygienists and nutritional management by a dietitian is also essential in patients with dysphagia. We call this model the interdisciplinary team model, in which the role of each professional are clearly defined, and the patient is approached in multidisciplinary manner. In hospitals with limited sources, not all the disciplines involved the dysphagia may be available. In such case, we adapted transdisciplinary team model. This model involves a smaller team of professionals with compensatory roles, such as nurse and physical therapists who primarily provide swallowing training and oral care. Bedside screening is a crucial step in the assessment of dysphagia. It is often performed by a nurse or rehabilitation therapist. The role is significant, as they conduct observational assessments such as eating assessment tool 10 and screening tests such as reflective saliva swallowing test, modified water swallowing test, food test, and tongue pressure. Invasive evaluations such as video endoscopic or video fluoroscopic examination of swallowing performed by a medical doctor or a dentist, with the rehabilitation therapist present advice on posture adjustment and compensatory swallowing techniques. This may be the case in Korea as well. Other evaluation methods include high-resolution manometry, 3D CT, echography, and electromyography. But they are primarily evaluated in the research field and are not widely used in clinical practice. In Japan, the practice of swallowing food in treatment of patients with dysphagia is called direct training. Speech language hearing therapists mainly perform it. It includes inducing of swallowing reflex, food forming, and repetitive swallowing, superglottic swallow, and Mendelssohn maneuver. Incidentally, this is a lunch box in a food form suitable for patients with dysphagia, called kofukuzen in Japan, designed to be eaten on festival occasions. This may seem odd in Korea, but in Japan, physical or occupational therapists rarely provide direct training. In Japan, the practice of swallowing without food, known as indirect training, is a key component in treatment of dysphagia. These methods, which carry no risk of aspiration, can be implemented by a diverse range of professionals, including rehabilitation therapists, nurses, and others. Indirect training, on the other hand, encompasses variety of exercise such as tongue of motion and swinging training, Shakya exercise, contact against resistance exercise, electric or magnetic stimulation for suprahyoid muscle or for sensory stimulation, posture adjustment, and full body exercise. By the way, this is Pekopan, a tool made of silicone to strengthen tongue pressure. In Japan, posture adjustment are especially required by physical or occupational therapists in the rehabilitation of patients with dysphagia. Respiratory training is essential in dysphagia rehabilitation to prevent aspiration pneumonia. Older adults and patients with stroke often have impaired coughing and respiratory function. Breathing exercise effectively improve routine food and saliva penetration into larynx and prevent or improve aspiration associated with dysphagia. Respiratory training include pulse deep breathing, inspiration muscle training, and improved thoracic mobility. In 2020, the Ministry of Health, Labour and Welfare issued a guideline recommending the integration of rehabilitation, nutrition management, and oral care in Japan. This is aimed at promoting independence of the older population and preventing the seriousness of illness. Currently, hospitals that successfully coordinate these three areas can receive higher reimbursement. The collaboration between rehabilitation therapists and dietitians has led to development of a new system of improving muscle strength and endurance, and a new system for nutritional adjustment based on patient nutritional adjustment. Nutritional adjustment based on activity level, prevention or improvement of raw nutrition, and improvement of appetite. In addition, collaboration between rehabilitation therapists and dental professionals can help maintain and improve oral and swallowing function, prevent aspiration pneumonia through oral hygiene, and provide general management. In recent years, the presence of sarcopenic dysphagia has been attracting attention. The presence of generalized sarcopenia also decreases the muscle of the oral cavity and pharynx and increases the percentage of patients suffering from sarcopenic dysphagia. Sarcopenic dysphagia is not only a problem for community-dining older adults, it is said to accelerate dysphagia in neurologic disease. When patients are malnourished or inactive, sarcopenia occur, and oral function decline at the same time. This is in turn accelerates malnutrition and further aggravated sarcopenia due to the decrease in variety of food available. Rehabilitation therapists need to work with dietitians to strengthen muscle and improve physical activity according to nutritional status of patient. This study reports that sit-to-stand exercise improves swallowing function in stroke patients. What is noteworthy about this study is that high-frequency sit-to-stand exercise improves not only activity of daily living, as indicated functional independent measure claim, but also swallowing function as indicated by food intake level scales. It is pairs. Sit-to-stand exercise improves general sarcopenia and swallowing function that improves stability of neck and trunk, which support head may also have facilitated oral function. This indicates that rehabilitation therapists need not only oral and throat training, but also full body exercise when dealing with dysphagia. This is our research topic. Patients with dysphagia need to seek liquid modify from their meals. However, this may result in a decreased quality of life and dehydration due to decreased fluid intake. If we ask the patient with dysphagia what you would like to eat, what would they say? I want to eat what I want. I feel like I could drink a beer without choking. I'd like a Coke. Oh. Do they just juice and fruits? Is no evidence that they feel they can drink what they like without choking. It's an interesting clinical question. This is our research results. This study determined whether carbonate drinks are more accessible to swallow than other liquid. The figure on the left shows the time of laryngeal elevation movement. Older adults have longer laryngeal elevation time than younger adults, indicated that they swallow more slowly. Furthermore, carbonate beverage indicated CB has a shorter laryngeal elevation time in older adults than water. This indicates that swallowing has become smoother. The right figure shows subjective difficulty of swallowing, with the lower bar indicating easier swallowing, this bar. This figure shows the carbonate drinks are subjectively easier to swallowing than water. Interestingly, unsweetened carbonate water, this is CW means carbonate water, is more challenging to swallow and does not shorten laryngeal elevation time. Presumably, the mixture of carbonation stimulation and sweetness positively affect swallowing function. This is a hypothetical mechanism by which carbonic acid improves swallowing function. Carbon dioxide dissolved in liquid synthesized into carbonic acid by the enzyme CF4 in saliva. And these stimuli may be transmitted afferently through the triggering facial nerve to the brainstem and activation swallowing central pattern generator. And when the carbonate distillate gas in carbonate water split into bicarbonate and free proton. Free proton means ioid ion, yeah, H plus. In oral cavity, the free proton stimulated acid sensitive test receptor cell on the tongue, PKD2L1 expressing cell. These stimulate transmitted afferently through to the brainstem and activated CPG. Now, this is another hypothesis. It is well known that capsaicin activated swallowing. This involves TRPV1 channel. Carbonate water may stimulate another channel, A6-3, causing action potential in the superior laryngeal nerve and activating the swallowing central pattern generator. Patients with dysphagia often served liquid thickened. In more severely dysphagic patients, carbonate drink may also benefit from thickening. We meticulously compare the swallowing dynamic of water carbonate drinks, thickened water, thickened carbonate drinks, providing you with comprehensive knowledge of dysphagia management. And the results show the thickened carbonate drinks improved aspiration and swallowing reflex more than water. The penetration aspiration scale means pass. We further found thickened carbonate drinks were subjectively easier to swallow than thin juice, plain juice. Yeah. You can see the VA image. And water, this is the water, sorry. Whiteout during examination in distinct and laryngeal penetration is present. The patient has a cough reflex, but it is unclear if he can cough it out, as he has done so many times. The patient is probably aspirating. You can see thickened water. Whiteout is more pronounced than with water. Although laryngeal penetration is observed, the degree of choking is not as severe as with water. Whiteout is more precise than water because a thickening of liquid enables it to be held in the oral cavity, which is expected to reduce the early pharyngeal invasion at the time of feeding. You can see carbonate drink image. Whiteout is shaper and more prolonged than with the thickened water. The timing of the swallowing reflex elicitation is almost identical to that of the thickened water. There is no observation of laryngeal penetration and clearance is good. You can see the findings are almost identical to those of carbonated drinks. The carbonation may have affected movement of the back tongue and pharyngeal contraction. This is a VF image. You can see retention of dorsal surface of the tongue is good, and this appears to be delayed induction of the tongue reflex. However, there is residual in the epiglottic and the perisinus forms, piriform sinus, with some laryngeal penetration. Additional swallowing generally clears the patient, but there appear to be slight aspiration. You can see second juice image. The delay in the elicitation with swallowing reflex compared to juice, but the residual after additional swallowing appear to be slightly less. Laryngeal penetration during swallowing is not much different from that of juice. You can see carbonated drink image. Both swallowing reflex and clearance are improved compared to juice and second juice. You can see carbonated second drink. Swallowing reflex elicitation is slower than carbonated drinks, but laryngeal penetration is less than with or second juice. And this is the potential of artificial intelligence, AI adaptation to dysphagia rehabilitation. Currently, the diagnosis of VE and VF is left to visual judgment by physician and dentist. These quantitative assessments are often used in research area and are not often used for clinical diagnosis. In the future, AI will enable more accurate determination of severity of dysphagia in VE and VF and how to respond to it. AI may also help rehabilitation therapists in decision making by determining food form and training methods for patients with dysphagia. This is the take-home message. In the future, AI will help diagnose the severity of dysphagia and determine food form and training methods. Thank you for your attention for my presentation.
Hello everyone. I am honored to give a presentation for you about research ethnic for researchers. Focusing on the definition, history, and principles of research ethnics. My name is Taehyung Yoon, Professor, Department of Occupational Therapy in Dongso University. Contents as follows. Example of research ethnic misconduct. Research ethnic misconduct such as fabrication, duplicate, publication, etc. Professor Hwang Woo-seok of Seoul National University in 2004. We have the very big shot because of his research is very big opaque, and duplicate publication of the same research result in Korean and English, like this. 2. Scope and definition of research ethics. What is research misconduct? Plagiarism, falsifications, fabrication, and improper authorships. And other research miscount as follows. Use of one's own research results, prohibition and duplicate publication, and self-plagiarism. Researchers make use their own research results that has not been previously published when writing research paper, etc. Scope and definition of research ethics. Protection of human rights. Nuremberg Code, 1947. Research subjects participating in experiments involved humans must only participate in the research if they have given voluntary consent. Declaration of Helsinki, 1975, is very important. When there is a risk of harm to participants involved in specific research, or when there is at least no direct benefit to them, this fact must be disclosed. Research can only be conducted after obtaining informed consent from the subject and approval from the institutional review board. Very important. National Research Act of the United States, 1974. The research proposal must mention the research problem, theoretical background necessary, and the significance of the study, and the research design must be clearly described, ensuring that it is appropriate for addressing the problem. Belmont Report, 1979. A foundational document for the current system. Protection, human research subject. Code ethical principles. First, respect for persons. Second, beneficence. Third, justice. This one very important. Respect for persons. Respect for persons consists of at least two ethical benefits. First, individuals should be treated as autonomous beings. Second, individuals with diminished autonomy should be protected. Therefore, the principle of respect for person is divided into two distinct moral requirements: the recognition of autonomy and the protections of those who lack autonomy. Principle and history of research ethics. Autonomy. Autonomy refers to the capacity of individuals to have the authority to determine their own actions and happiness. According to the principle of respect for persons, researchers must recognize that constitutes adequate opportunity for thoughtfully considering and choice for human research subjects. beneficent. Treating people ethically involved not only respected their decision and protection them from harm, but also striving to safeguard their welfare. First, do no harm. Second, maximize possible benefit and minimize possible risk. This one very important. Justice. Justice means that benefit and burden arising from research should be distributed fairly. In other words, if some individual or groups enjoy the benefits, while others are subjected to risk, that is not justice. The three ethical principles of Belmont and their balance. The intention of the committee was for the three principles of Belmont to have equal moral weight. This means that in certain situations, the three principles may conflict with one another. For example, according to the principle of respect for persons, one might argue that children should be restricted from participating in research because they lack the capacity to make their own choice. However, according to the principle of justice, children should also have the opportunity to participate in research and benefit from it. Principle of History of Research Ethics, Belmont Report and U.S. Federal Regulations. Principle of Benefits. To minimize the risk that may arouse the research subject, the following method should be employed. 1. Conduct the research according to the well-designed protocol that does not expose research subject to unnecessary risk. 2. Whenever deemed necessary, use standardized methods and procedures for diagnostic or therapeutic purpose for the research subject. This level of risk to which research subjects may be exposed should be reasonable in comparison to the anticipated benefit and the significance of the expected research result. In evaluating benefits and risk, the Institutional Review Board (IRB) should only consider the benefit and risk that may arise from the research itself. Distinct from the risk and benefits of treatments, and subjects should receive regardless of participation in the study. Belmont Report and U.S. Federal Regulation Principle of Justice. The selection of research subjects must be fair. To evaluate this, the Institutional Review Board (IRB) should consider the purpose of the research and the environment in which it will be conducted, particularly recognizing issues related to vulnerable research subjects. For example, children, prisoners, pregnant women, individuals with mental disabilities, and those who are economically or educationally disadvantaged. Belmont Report and U.S. Federal Regulations, Principle of Respect for Persons. Informed consent must be object from prospective research subject or their legal representative based on the sufficient explanatory. Informed consent very important. Summary. Research ethics have developed to protect human research subjects due to historical events and contemporary case of abuse. The Belmont Report, also with U.S. federal regulations and professional codes of ethics, provide guidelines for Institutional Review Board (IRB) to review and approve research based on 3 fundamental ethics principles: respect for persons, beneficence, and justice. 4. Key contents of research ethics regulations. Definition of misconduct. Fabrication, falsifications, plagiarisms, and improper authorship attributions, and other serious deviations behavior, retaliation against whistleblower, obstruction of investigations. 5 factor is very important, and other outside interference with research, sex discriminations, unfair evaluations, misuse of research funds. Protection of the right of whistleblower and the subject of investigations. Protect of whistleblower. Guarantee of anonymous. Prevention of adverse consequences. Follow-up actions as follow. Responsible entity for verification of case of misconduct. Status of limitations and principle of verifications. Investigations committee for burden of proof. Like this. 5. Action of take in cases of research ethics violations. For example, post-take research integrity verification procedure, like this. Report and receptions and preliminary investigations. Determination of whether to conduct a full investigations. Notification to the whistleblower within 10 days. Investigation required. Formation of the investigations community for the main investigations. Gathering options. Determination, sanction, and action. This one is within 15 days, and this one within 30 days, and this one within 90 days, and up here. Action to take in the event of research ethics violations. Follow-up actions for research misconduct. Researcher. Suspension of the research project. Recovery of research funds. and the restriction of participations in research and developed projects. Research institutions, disadvantages in evaluation and indirect cost calculations. Special Investigation Committee, in case involve multiple institutions and national issues. A special investigations committee will be established within the National Science and Technology Commission to conduct the investigations. Supplementary provisions, effective date. Example of misconduct in research funding, misuse of research fundings, like this. Professor who embezzled personnel's cost, and professor someone from a university located in Busan. Misuse of research fund, personal expenses. Professor who partially pay labor costs to graduate students and others, and use the funds as shared expenses. Travel expenses. If travel expenses were requested and paid for the person trips unrelated to the research or for persons attending conference. In case where payments were made to non-participating researcher, accommodation, expenses and fee, expenditure for utilities such as electricity, water, and gas that are not directly related to research, expenditure for personnel and indirect costs such as newspaper, business card wash with fee, fine, and penalties. Expenditure for operational costs of the institutional such as vehicle, insurance, and general clothing expenses. Misuse of research fund, technical information activity expenses, etc. For example, in case where the expert utilization fee has not been transferred to the account of the relevant expert, or where there is no specific support documentation to recognize the payment. Compensation for research results, fair compensation for research outcomes, incentives, no restrict, government projects, 25% percentage of labor cost, industry, 20% of total research funds, external consulting lecturer available for both teaching and attending. Compensation for incorrect research results. Researchers are receiving a gift of an overseas travel vouchers from the foreign company that supplied equipment for the project. Reference like this. Thank you very much.
Hello everyone, it's my pleasure to be here. My name is Matana Prumipapat or May. Today I'm going to talk about pediatric aquatic therapy, services, knowledge, and current practice in Thailand. What do we know and where do we go? I am a university lecturer and a pediatric PT at Naresuan University, Pittsburgh, Thailand. My background was a Doctor of Developmental Neurology, UMCG, the Netherlands, and this is my research team. Water has been used in integrative medicine since ancient time.
The physics of aquatic therapy. Buoyancy effects. Hydrostatic pressure. Viscosity hydraulic resistance. Thermal energy transfer.
Pediatric aquatic therapy, which I briefly call PAT, has been reported to be one of the best interventions in integrative medicine. We aim to survey the number of PAT clinical settings across Thailand and to understand the knowledge and current practice of the PAT for children with special needs by PAT professionals. From July to October 2024, 137 aquatic clinical settings across Thailand were surveyed, accounting for 177 PAT professionals. Result: we received 114 responses out of 137, which were accounted for more than 80% response rates of all respondents. 74 current PAT settings are found, and there are 91 PAT professionals in total. This pie chart shows the educational background of those PAT team. The majority number are PTs and mostly work in special education center. The majority of PAT staff age range between 21 to 30 years old. Work experience was about 1 to 5 years of the PAT field. About the children they treat, there are all age range and age group of patients, mostly with the school age as you see. The top 3 types of children are CP or GMFCS level, autistic, and Down syndrome. The PAT workload is about 1 to 5 children per day per one staff. Current PAT clinical settings are in the central region, followed by the northern and the northeastern regions of Thailand. And this is the category of the questions. 4 types. The average score is 12 out of 18 points. The multiple choice questionnaires show that most PAT professionals know the principle of hydrodynamics and the framework in their current practice, although some staff lacked formal education in aquatic therapy, such as the PT assistant and special educationist. The open-end questions, 3 themes were identified as you see here. To sum up, this survey demonstrated the general perspective of the pediatric aquatic therapy in Thailand. 74 clinical settings in Thailand implement PAT to improve health and well-being outcomes for children with special needs. Next, where do we go? We could level up PAT as a holistic health and wellness training for practitioners. Now we have the Thai version of assessment tools, and I have a training. We keep exploring new techniques, and we plan to implement the online course for parents and health professionals. And reflections and feedback is always welcome. I am very thankful to the Korea Society of Integration Medicine for organizing this Congress. I sincerely appreciate the kind invitation to join this talk, and many thanks to the President, Professor Lee, and my senior best friend and colleague, Professor Oh. Again, it's a pleasure to be here today. You can always reach me via the email, and any feedback or questions as well as future collaboration are welcome.
Hi everyone, my name is Majan Mortazai. I am coming from the University of Bonn, which is in Germany. I am a certified professional for user experience, certified by the UXQB International Usability and UX Qualification Board in Germany. And today I am here to give you a very brief overview on the application of usability engineering to medical devices. So yes, the contents of this presentation will be 3 main points. So the first one will be usability as an international standard. The second one, usability in the context of medical devices. And the last part will be the usability engineering process. So first off, we have 2 frameworks, which is firstly the international standard and the technical report, which go hand in hand. So first to the international standard, it specifies a process for manufacturers to analyze, specify, develop, and evaluate the usability of a medical device in regards to its safety in order to identify, assess, and mitigate risks associated with the correct use and user errors, but not abnormal use. So if the international standard has been complied with, the usability of a medical device related to its safety is presumed to be acceptable unless there is objective evidence to the contrary. So we have the framework for the application of usability engineering on medical devices on the left. Then on the right, we have a technical report that functions as kind of a framework that provides background information and guidance on how to implement those techniques. So this form is called the Guidance on the Application of Usability Engineering to Medical Devices. Its purpose, as said, is to provide background information, general understanding of, and guidance to helpfully implement usability engineering. The important part here is that this is no requirement. The technical report is no requirement, but a guidance that also offers tutorial information on how to implement the elements required by the IEC 62366-1, which is on the left. And it contains user research techniques, analysis techniques, design techniques, medical device usability approaches, planning and implementation of the usability engineering process, and benefits of applying usability engineering, as well as how to improve user satisfaction. So let's define usability in the context of medical devices, but also define it first in the overall understanding. So following the ISO 9241-11, which provides a framework for understanding the concept of usability and applying it to situations where people use interactive systems and other types of systems, or also products and services. Usability is defined as the extent to which a product can be used by specified users to achieve specified goals with effectiveness, efficiency, and satisfaction in a specified context of use. So these 3 words are very important for usability, effectiveness, efficiency, and satisfaction. Going on to the IEC 62366-1, which we just saw in the slide before this one. Usability is defined as characteristic of the user interface that facilitates use and thereby establishes effectiveness, efficiency, and user satisfaction in the intended use environment. So we have another important element here, which is the user interface, which is also abbreviated as UI. And the user interface are basically all means by which the user and the medical device interact with each other. So basically going to the main part, which is the usability engineering process, we have a little diagram here, which is an example of a usability engineering project for a graphical user interface. So this is just an example. But what is the usability engineering process? Well, this process says that the manufacturer shall establish, document, implement, and maintain a usability engineering process to provide safety for the patients, users, and others. This process shall address user interactions with the medical device according to the accompanying documentation. The goal of it is to identify, minimize use errors, and thereby reduce use-associated risk. Some, but not all forms of incorrect use are suited to control by the manufacturer. The usability engineering process is related to the risk management process, which includes the transport of the medical device, its storage, the installation, the operation, but also maintenance and repair and disposal. The usability engineering activities for a medical device shall be planned, carried out, and documented by a personnel competent of the basis of appropriate education, training, skills, or experience. Very important here is that everything should be documented so that you can look at the documentation later on and find the same objective findings as you did the first time. Another important point is that this process is iterative, so means it should be repeated until there are no further findings and all risks have been reduced or eliminated, which can be assessed by the manufacturer. So one requirement to do that is that the manufacturer has to have all-round knowledge of all known or foreseeable hazard-related use scenarios prior to selecting those hazard-related use scenarios that you will use for the user interface evaluation plan. Again, the goal of this process, of this usability engineering process, is to identify, minimize use errors, and thereby reduce use-associated risks of the medical device for the user, the patient, or others. And yeah, you can take a look at this diagram and get a picture of how the usability engineering project can look like. Then lastly, to sum up everything a bit, so if you apply usability engineering to medical devices, what it does for you is that in terms of safety, it decreases the harm, hazard, and risks which can be induced by the product, by the device to the patient or others. And when you connect it with usability, you can decrease these hazards and at the same time increase the effectiveness, efficiency, and satisfaction of the product, of the medical device for the patient. So you have safety and usability in one. If you would like to have any further information of the parts that we talked about today, because this was a very, very small, a very brief presentation without any details, you can take a look at the bibliography, at the books, and get a deeper understanding of everything. I would like to thank you for your attention. Thank you very much.
Hello all the distinguished guests. Please let me present my presentation titled Research Trends in Creativity and Character Education for Nursing Students in Korea. Background: in today's complex healthcare environment, there is a growing emphasis on nurturing nursing students with creativity, and strong character. Creativity and character education are essential for developing core competences in patient-centered care. However, there is a lack of systematic analysis and related research in this field. This study aimed to review research trends on creativity and character education for nursing students, published from 2007 to 2023, identifying the current state and suggesting future directions. The study analyzed a total of 11 research articles related to creativity and character education for nursing students, published in domestic journals between 2007 and 2023. Methods. This review categorized studies by quantitative research design, focusing on experimental, non-experimental, and methodological studies. Major variables included creative personality, critical thinking, problem-solving ability, and leadership. The research topics were classified according to keywords and publication year. As a result of our study, among the 11 studies analyzed, 100% were quantitative research, with experimental studies comprising the majority at 8 studies. In contrast, non-experimental studies accounted for only 1 study, and methodological studies made up 2 studies, indicating a strong focus on experimental approaches in this field. Keyword analysis revealed that the most frequently addressed keywords were related to nursing students, accounting for 27.6% all of keywords. Creative personality and creativity also appeared in 27.6% of cases, followed by critical thinking 17.2%, problem-solving ability and design thinking 10.3%. Research publications increased significantly from 2016 onward, with a noticeable focus on creativity and character education for nursing students in recent years. We conclude this review indicates strong references for experimental approaches in evaluating the effectiveness of creativity and character education for nursing students, with a heavier release on quantitative methods. Future studies should extend the use of qualitative and non-experimental research to gain a more comprehensive understanding and to develop effective education strategies that foster creativity and character in nursing education. Thank you for listening.
Nice to meet you. My name is Haen Kim from the Ulchi University. Today, my topic is a study on a personalized exercise intervention program for elderly people. As we age, muscle loss occurs, function declines, and the risk of falls and fracture increases. In addition, physical activity decreases, making us vulnerable to various diseases such as plague T and Sarcopenia, which increases the risk of death. Effective interventions should be applied to prevent fall T and Sarcopenia that occur due to aging, but existing programs have been presented without considering the personalized characteristics of each older person. Therefore, this study was conducted to investigate the effectiveness of a personalized exercise intervention program targeting elderly people in Korea. Through the cooperation of a welfare center, subjects aged 65 years or older were recruited. Of the 25 subjects recruited, 16 were selected as final subjects. Easy techniques was used to establish an one-on-one customized exercise program. The exercise intervention program was conducted for 6 weeks and consisted of a 12-session face-to-face program and a non-face-to-face program for self-practice at home. The one-on-one customized exercise list was composed of exercises suggested by the Easy Techniques program based on the results of the pre-evaluation. To determine the effect before and after exercise, grip strength, one leg standing, TUG test, FTSST, and 5-meter walking. In addition, BAS, BBS, and stress index were assessed. After checking the analysis before and after exercise, FTSST, BAS index, TUG, and stress index decreased, whereas gait speed, grip strength, and BBS increased. This suggests that a personalized exercise intervention program is effective for the elderly in the community. Therefore, it is recommended that this program be used to prevent and manage plague T and Sarcopenia, diseases that occur due to aging. In addition, the health management program for the elderly will need to be designed as a one-on-one customized program like that of advanced countries. Thank you for listening to my presentation.
The title of this study is a systematic literature review of the effects of manual therapy applied to neck dysfunction in Korea. The presenter is Hyun-Sung Lee. Neck dysfunction is one of the most prevalent musculoskeletal diseases worldwide, including in developed countries, and is significantly affected by the working environment, education level, and income level. This is a significant social cost and is a major cause of productivity loss. The underlying cause of neck dysfunction is not clear, but damage to soft tissue caused by poor lifestyle and repeated working conditions leads to neck dysfunction. Manual therapy, which is one of the physical therapy interventions, is widely used for musculoskeletal disease including neck dysfunction, and various techniques are used for manual therapy to improve neck pain and dysfunction. In addition to Mackenzie therapy, Kaltenborn therapy, Maitland therapy, Mulligan therapy, chiropractic. There are many other treatment techniques such as joint or soft tissue mobilization, manual correction, corrective tissue massage, facial relaxation, strain, counter strain, and muscle energy technique. Many empirical studies have been conducted on neck pain and neck dysfunction based on these treatment techniques, such as various treatment interventions and exercise techniques. But most of them are studies comparing the effects of each intervention. Systematic literature review can be used to draw more general conclusions because individual studies use different research methods, which can lead to different research results. Systematic literature review is the synthesis of literature with solid research methods and objectives by rigorous methodology on a particularly narrowed topic according to scientific and objective methods. As a result, various studies can be integrated using methods to reduce bias and probability errors. Therefore, this study aims to understand the research status of manual therapy interventions for neck dysfunction in Korea, analyze the characteristics, and evaluate the quality of the research. This study followed the steps of the International Research Reporting Guidelines, Cochrane Library, and PRISMA. It was carried out based on PICOS, a general technical form of literature review. Literature search was conducted independently using 5 domestic databases according to the protocol. Of the 925 selected literature studies, a total of 19 studies were selected excluding duplicate literature, studies not related to neck dysfunction, studies with only abstract and presentations, studies with no manual therapy intervention or other intervention methods, and cases where the same intervention method was applied to different sites. The intervention method followed the guidelines presented by 5 manual treatments, and the intervention method was selected. The quality evaluation of the literature used Cochrane Library's risk of bias tool. Of a total of 19 studies, 3 studies were found to be an uncertain risk for random sequence generation, and 15 studies were found to be an uncertain risk for allocation concealment. In addition, only 1 study was mentioned for blinding of participants and personnel, and blinding of outcome data was not mentioned in all studies. Incomplete outcome data showed a high risk in 7 studies, and selecting reporting showed a high risk in one study. The manual therapy methods applied to neck disability chosen in this study were found to have statistically positive effects on the change in pain, neck disability, and range of motion. However, further large-scale clinical studies on the effects of manual therapy are necessary because the variation in the number of samples and the duration and amount of intervention can lead to clinical heterogeneity among the studies.
Hello, my name is Seongjin Jung. I will giving presentation. Presentation topic is effects of posterior pelvic tilt exercise on hip joint muscle activity and strength in 20 college students. Contents. Pelvic deformity. Pelvic deformities typically include an anterior and posterior tilt. Anterior tilt occurs due to the pulse couple between the hip flexors and the erector spine muscle, while posterior tilt occurs due to the pulse coupled between the hip extensors and abdominal muscle. Anterior tilt contributes to an increase in lumbar lordosis, whereas posterior tilt decreases lumbar lordosis by flexing the lumbar spine. Necessity of the study. Number 1, posture correction. Number 2, strength improvement. Number 3, intervention method. Study participants. This study selected 18 past years students from Busan B University. As participants, the subjects were individuals who had not engaged in strength training for the past 6 months and were able to follow the researcher's instruction during the exercises. Before the experiments, the participants were informed of the study purpose and method, and they voluntarily agreed to participate. The general characteristics of the participants are shown in Table 1. Measurement method. This study used the smart camera tension sensor. This photo is a smart camera tension sensor. Second measurement method, the surface EMG device. This photo is a EMG device. Exercise method. In this study, 18 participants were divided into 2 groups of 9 based on the exercise method. The first experimental group performed backward rocking, while the second experimental group performed sitting hip flexion. Backward rocking exercise group. This photo is a reference photo. Second, sitting hip flexion exercise group. This photo is reference photo. Result. Table 1 is backward rocking group result. Significant increase in muscle activity after the intervention could be observed in the rectus femoris. Muscle activity also increased post-intervention could be observed in erector spine. Muscle activity decreased after the intervention could be observed in rectus abdominis and gluteus maximus. Table 2 is muscle activities of the sitting hip flexion group. Significant decrease in muscle activity after the intervention could be observed in gluteus maximus. Muscle activity increased post-intervention could be observed in rectus femoris and erector spine. Muscle activity decreased after the intervention could be observed in rectus abdominis and gluteus maximus. Table 3. Strength of the hip flexion movement each group. This table is comparison of pre and post intervention hip flexion strength measurement. Strength measure using the camera device. Significant decrease in strength could be observed in the sitting hip flexion group. Table 4. Comparison of the activities and strengths between the group. No significant difference in muscle activities across the groups could be observed. significant difference observed in hip flexion strength. Discussion. Comparison to previous research, earlier studies showed hip extension increased gluteus maximus activation. Our findings suggest reduced engagement during hip flexion. Limitation. First, small sample size. 2. Participants who are not diverse. 3. Short-term intervention. Conclusion. Backward rocking exercise effectively strengthens the rectus femoris and erector spine. Sitting hip flexion exercise reduces gluteus maximus activity but strengthens the rectus abdominis. The exercise's direct impact on posterior pelvic tilt is inconclusive. Future research with larger samples and biomechanical analysis is needed. Thank you.
Hello, 2024 International Conference of Korean Society of Integrative Medicine. Oral presentation. Presentator, Yang Gi-Chu, PT, Department of Rehabilitation Therapy, Doseongsin Hospital Manager. Co-author, Gunter Lee, PT, Department of Physical Therapy, Gangnam College of Information Technology Professor. The title of this study is A Physiotherapy Program for Adolescent Baseball Players with Scapular Dyskinesis. Comparison of the effects of posterior shoulder stretching combined with scapular stabilization exercises. Background. Scapular dyskinesis. Scapular dyskinesis has been shown to be common in overhead arthritis and has been associated with rotator cuff muscle strength imbalances. Posterior shoulder tightness (PST) has been suggested as an important factor contributing to scapular dyskinesis. Therefore, rehabilitation programs should focus on combining posterior shoulder stretching with scapular stabilization exercise (PSSE) as an intervention. To determine the effects of combining posterior shoulder stretching with scapular stabilization exercises on rotator cuff muscle strength, functional strength ratio (FSR), range of motion (RM), and pain. Purpose. This study was to examine the effects of posterior shoulder stretch combined with scapular stabilization exercise (PSSE) on adolescent baseball players diagnosed with scapular dyskinesis. Specifically, the study aimed to analyze and compare changes in rotator cuff muscle strength, functional strength ratio, range of motion, and pain levels following the application of PSSE. The ultimate goal was to identify and propose the most effective physiotherapeutic intervention method currently available for this population. Participants were randomly located into two groups of 15 individuals each. One group received posterior shoulder stretch combined with scapular stabilization exercise (PSSE), while the other group underwent scapular stabilization exercise (SSE) alone. Method 1. Both groups participated in their respective interventions for a duration of 6 weeks. Following the intervention period, outcomes were measured using identical assessment methods for both groups. The resulting data were then compared and analyzed to evaluate the effectiveness of each intervention. 1. The scapular discrepancies patterns 1 and 3 of the participants was compared and diagnosed against normal scapular movement pattern 4. Method 2. 2 measurements were taken of the isokinetic peak torque per body weight (PT/BW) for the following rotator cuff muscles: concentric external rotator (CER), eccentric external rotator (EER), concentric internal rotator (CIR), eccentric internal rotator (EIR). 3. Additionally, the following parameters were assessed: functional strength ratio (FSR), range of motion (ROM), pain. Results: 1. After 6 weeks of PSSE, there were significant increases in CER PT/BW, EER PT/BW, EER to CIR ratio, and internal rotation RM. 2. Conversely, there was significant decrease in EIR to CER ratio, internal rotator RM, and GIRD compared to pre-intervention measurements. 3. No significant differences were observed in isokinetic PT/BW of CIR and EER post-intervention. 4. The SSE group showed no significant differences in any measurements for isokinetic PT/BW, FSR, and RM post-intervention. 5. Pain significantly improved in both the PSS group and SS group post-intervention. Conclusion: 1. Both the PSSE and SSE intervention resulted in greater pain relief. 2. However, only the PSS group demonstrated improvements in RM, CR, EER, PT/BW, and FSR. This finding suggests that the PSSE intervention may be a more effective program for enhancing rotator cuff muscle strength and balance, particularly concentric and eccentric external rotation muscle strength and functional strength ratio. 3. Additionally, it may be expected to prevent shoulder injuries in adolescent baseball players with scapular dyskinesis. Thank you.
Hello, I'm Chung-Yuk Kim from Catholic University of Busan. I will present on the topic of comparison of the immediate effect of IISEM, proprioceptive neuromuscular facilitation, and static stretching on dorsiflexion angle and gastrocnemius muscle tone. Dorsiflexion is an essential element in working and active movement in daily life. Limitations in dorsiflexion are associated with patellofemoral pain syndrome, Achilles tendonitis, excessive tendon in the calf muscle. Representative methods for intervening in gastrocnemius muscle shortening include clinically known IASTM, instrument-assisted soft tissue massaging, and proprioceptive neuromuscular facilitation, PNF, and static self-stretching exercise. These interventions using now is IASTM. It's massage tool. And KNF stretching. There have two methods, KNF technique, contract release and hold release. Finally, there is static stretching. This is one of most traditional methods. Muscle flexibility is the ability to maintain an appropriate ROM at our joint for normal functioning of the musculoskeletal system, and is essential for promoting normal movement, maintain proper posture, and preventing injuries during exercise and daily life. So, this study aimed to investigate the immediate effect of applying the presented IASTM, KNF, contact release technique, and static stretch technique using for gastrocnemius muscle stretching to the gastrocnemius muscle on the dorsiflexion angle at the ankle joint and the muscle tone of the gastrocnemius muscle. Method. The subset of this study are selected as those whose active ankle joint dorsiflexion test angle were restricted by 5 degrees or more from the normal angle. ROM 5 degrees. And test 1, active angle dorsiflexion ROM test using goniometer. Test 2, most tension test of the gastrocnemius muscle using myotroprom device. This device tests muscle tone and stiffness. And intervention, 3 methods, IASTM and KNF, contract to relax technique, and static stretching. The collected data were statically analyzed using the SPSS program, and between group on one-way anal bar and between repetition on one-way repeated anal bar, and using positive technique and LSD and bumperonic correction. This is general characteristics of research subject, and comparison of the anchor or dorsiflexion angle change show a significant difference between repetition of all groups. But there are no significant difference between groups or repetition. The post-analysis or result show a significant difference between all repetition in all groups. And most of medial gastrocnemius show between repetition in all groups, but there are no significant difference between groups or repetition. A result of post-hook analysis in an ISTM group, general repetition shows significant difference from 1 repetition, 2 repetition, and 3 repetition in KNF group, and 1 repetition shows significant difference and 2 repetitions. And the muscle tone of lateral gastrocnemius muscle show significant difference from repetition in all group, and only first and second repetition, so significant difference between groups. The result of this study show that all intervention applied to 3 groups increased the dorsiflexion angle and decreased the gastrocnemius muscle tone. Therefore, it was found that IASDM, KNF contractility technique, and static stretching technique were all effective interventions for the limitation of dorsiflexion angle ROM. And in particular, IASTM and PNF technique were found to be more effective in reducing the gastrocnemius muscle tone. Thank you for listening. Thank you.
Good morning, everyone. My name is Min-Sung Lee, and I am honored to present our research at the 2024 International Conference of the Korean Society of Integrative Medicine. Today, I will be discussing the immediate impact of hamstring contraction method on knee angle and muscle tone in healthy young adults in their 20s. Before diving into the details, let me outline the structure of my presentation. Contents. Number 1. Background and significance. Number 2. Methodology overview. Number 3. Comparative analysis of methods. Number 4. Clinical implications and future directions. Let's begin. Background and significance. The hamstring muscles are vital for knee flexion and hip extension, which are crucial in sports performance and daily activities. However, they are highly susceptible to injuries, particularly in active population. In rehabilitation and training, various methods are used to improve hamstring flexibility and reduce muscle tone. Our study focuses on comparing 3 specific techniques. First, open kinetic chain exercise using a reformer. Second, closed kinetic chain exercise using a sling. And third, self-myofascial release using a foam roller. This research aimed to identify the immediate impacts of these methods, helping practitioners make evidence-based decisions for rehabilitation and athletic training. Methodology overview. Our study involved 30 healthy university students in their 20s, randomly divided into 3 groups based on the exercise method. To ensure precise and objective results, we utilized 2 key tools. First one, passive knee extension angle to measure hamstring flexibility. Second is myotone device to assess muscle tone. Each group followed a specific protocol. First, reformer exercise focused on isolated hamstring contraction without weight bearing. Second, sling exercise emphasizing multi-muscle engagement and proprioception. Third, things formula self-myofascial release for recovery purposes. Comparative analysis of methods. Here are the major findings of our study. First one, open kinetic chain exercise reformer. Flexibility. This method resulted in the highest improvement in knee angle flexibility as measured by PKEA. Muscle tone. showed significant changes, ranking second most effective overall. Closed kinetic chain exercise, Sling, flexibility produced significant improvements, ranking second for knee angle flexibility. Muscle tone was the most effective in reduced muscle tone due to enhanced neuromuscular engagement. Self-myofascial release technique, foam roller. Flexibility showed the least improvement in flexibility. Muscle tone had the least impact on muscle tone but was the most effective for recovery purposes. This comparative analysis demonstrated that different methods can serve distinct purposes based on the goals of rehabilitation or training. Clinical implications and future direction. Our findings suggest several practical applications. First, tailored programs. Exercise methods should be selected based on specific patient needs, whether the goal is improving flexibility, reducing muscle tone, or promoting recovery. Second, comprehensive approach. Combining OKC, CKC, and self-myofascial release techniques may yield optimal result. Third, future research. Investigations into the long-term effects of these methods and their applications in diverse patient populations or injury types are essential. In conclusion, this study highlights the importance of individualized exercise prescriptions and the potential for integrated approaches improving hamstring function. Thank you for your attention, and I look forward to addressing your questions during the Q&A section. Thank you.
The study of correlation between physical task performance and dynamic balance in children with cerebral palsy, a pilot study. This study aimed to explore the correlation between functional task performance of the upper limbs, lower limbs, and trunk and dynamic balance in children with cerebral palsy. The study included 21 children with cerebral palsy from GMFCS level 1 to 3 with guardian's consent. Each child performed 6 functional tasks involving the upper limbs, lower limbs, and trunk, and their performance was recorded. The measurement of position for upper and lower limb functional tasks begin in standing position, figure 1 and 2, while for trunk task, it started sitting position, figure 4, 3, and 4. For upper limb tasks, significant correlation was found between COP measure and catching a ball with 2 hands catching a ball with one hand and two-handed ball bouncing. For all limb tasks, significant correlation were observed between COP measure and one-leg stand, kicking a ball, sit-to stand, and standing on unstable surface. Trunk task performance showed significant correlation between lifting the non-dominant leg and COP speed. This preliminary study identified functional tasks that effectively assess dynamic balance in children with cerebral palsy. Tasks such as catching a ball bouncing, one leg standing, kicking a ball, sit-to stand, standing on an unstable surface, and lifting the non-dominant leg can supplement balance evolution. Thank you for attention.
Hello, I'm Wang Kyung-Kim, an adjunct professor at Masan University, who will present the poster for the 2024 International Conference of the Korean Society of Integrative Medicine in Korea. The theme is Effects of 4 weeks acute training on physical strength and growth hormone in middle-aged adults with sarcopenia. Let me start now. The table of contents is introduction, methods, result, and conclusion. First is the introduction. This study aims to investigate the effects of 4 weeks of ski training on grip strength and growth hormone levels in middle-aged adults experiencing sarcopenia, suggesting effective exercise plans for the management of sarcopenia patients and providing basic data for the development of effective exercise programs for the prevention and treatment of sarcopenia. The second is the method. This study was conducted on middle-aged adults with sarcopenia. The experiment was divided into an exercise group and a control group. The circuit training consists of the following. Third is the result. Finally, the conclusion. It is necessary to clearly analyze changes in body composition in consideration of the onset of the duration and frequency of the exercise program and the participants' basic metabolic rate, nutritional status, and exercise history in future studies. But it was confirmed that circuit training had a positive effect on the physical strength, improvement, and growth hormone of middle-aged adults with sarcopenia diseases. This provides important implications for the future development of exercise programs for middle-aged adults with sarcopenia. That's all I have for you today. Thanks for listening.
Now, 2024 International Conference of Korean Society of Integrative Medicine. Poster, presentation, presenter, Yeon-Gi-Chu, PT, Department of Rehabilitation Therapy, Boseong-Sim Hospital Manager. The title of this study is The Effects of Upland Cross Kinetic Chain Movements on the Activation of Cerebral Anterior, Pectoralis Major, and Trapezius muscles according to short joint flexion angles in the scapular plane. Purpose. This study aimed to compare the muscle activation of the cerebral anterior, pectoralis major, and upper fibers of the trapezius during shoulder protraction exercises and various shoulder joint angles in the scapular plane. The objective was to identify effective exercise methods and provide foundational data for patients with weak scapula and individuals require selective strengthening of the serratus anterior. Participants. This study was conducted on a total of 35 male and female college students. Method. To measure maximum muscle activation, manual muscle testing was performed prior to the exercise program. The exercise program consisted of a single session in which scapular protraction exercises were performed separated according to the type of kinetic chain, open or closed, and at various angles 60 degree, 90 degree, 130 degree. A goniometer was used to adjust shoulder scapular plane and joint angles. Muscle activity during the exercise was measured using the American-made Telemaya DTS and Norasun systems. Results. 1. The serratus anterior showed differences in muscle activation based on the angles cross kinetic chain exercise, with the highest activation observed at 130 degrees. 2. The upper fibers of the trapezius exhibited angle differences in upper kinetic chain exercises, while the pectoralis major showed significant differences in both upper and cross kinetic chain exercises. 3. Muscle activation between the exercise chains showed no differences for all three muscles. Conclusion. 1. The study results indicated that as shoulder joint flexion angle increased, the muscle activation of the serratus anterior also increased. 2. However, compensatory actions in the upper fibers of the trapezius and pectoralis major was increased, suggesting that selective strengthening of the serratus anterior may not be the ideal approach. 3. To selectively strengthen the serratus anterior, it is advisable to perform shoulder flexion exercise at low angles where the compensatory action of the pectoralis major and upper fibers of the trapezius are minimal, potential providing a more positive impact. Thank you.
Hello, my name is Yeseo. This study is comparison of characteristics of speech sounds production in preschool children and adults. Duration measured by acoustic method is used reliable evidence to determine the normal speech sound development and provide information on the development of speech motor control. The purpose of study is obtain object data on the development of speech motor control by comparing the acoustic duration of speech sounds produced by preschool children and adults. A total of 75 people, 25 5 to 6-year-old children, 25 adults living in the special self-governing states participated in this study. Spectrum Korean pronunciation test was used to collect speech sound data. Table 1 was by phonetic complexity. All data in this study were statistically processed using the SPSS program. All duration were performed by two-way ANOVA, and post-hoc testing was performed using SHIP. The main effect of the group on consonant duration was not significant. In addition, the interaction effect of the group and the method articulation consonant duration was significant. The main effect of the group and method of articulation on vowel duration were significant. The main effect of group and word level on vowel duration was significant. The effect of group and word level interaction on the vowel duration was not significant. With increasing age, vowel duration and word duration decreased. There's no significant difference in personal duration between preschool children and adults. Producing the both and who was found that preschool children less speech motor control than adults. It was found that kinetic structure affect the ability of preschool children to produce speech bound.
My name is Jisoo Kim. I'm presenting my research on consonant development in children aged 4, 5, and 6. This study is based on the concept of what we call articulatory complexity. It's a theory that categorizes speech sounds according to the motor control needed to produce them. The goal of this study is to investigate in an acoustic way how consonants develop in children aged 4, 5, and 6. We studied 75 children, 25 from each age group of 4, 5, and 6 in Jeonbuk Province. Children were tested by naming pictures, and their speech was recorded and acknowledged based on consonant duration and vowel duration following consonants. In terms of results, when looking at consonant duration, we found significant effects of both age and articulatory complexity. We also found a significant difference between the lowest and highest levels of articulatory complexity. For vowel duration, we found that as children get older, the duration of vowels following consonants decreased. This suggests that with age, children's speech motor control is improving. However, articulatory complexity, it didn't significantly affect vowel duration, nor did it interact significantly with age. To sum up, we observed that both consonants and vowel durations decreases as children grow, indicating advancement in speech motor control. These findings offer valuable insight into the early stages of speech development in children. Thank you.
Hello everyone, I'm Kim Ji-won. Thank you for joining my presentation. I'll be discussing analysis of difficulties in infertility treatment for married adult women, focus on differences in educational levels. First, I will talk about the background and objectives of research. In 2023, Republic of Korea's total fertility rate reached 0.72, highlighting the accelerating low birth rate issue. This study aims to analyze the challenges faced by married women undergoing infertility treatments, focusing on differences in educational levels. Next, I will talk about the subject. The analysis was conducted using data from 302 married women who had undergone infertility treatment. This is the research method. Frequency and cross-tabulation analyses were performed and the educational levels. The subcategories for challenges faced during infertility treatment consisted of 6 items. This is the results. When analyzed by educational level, high school graduates reported mental distress and financial burden as the most difficult, while college graduates reported mental distress and physical pain. Those with postgraduate education or higher reported physical pain and mental distress as the most challenging. Finally, I will discuss the research results. Since married women undergoing infertility treatment experience different challenges depending on their educational level, it is necessary to reflect these differences in birth-related policies. That concludes my presentation. Thank you for your attention.
Hello everyone, I'm Park Ji-kyung. Thank you for joining my presentation. I'll be discussing a study on the quality of life of the elderly, focusing on differences by household type. First, I will talk about the background and purpose. As population aging processes, the quality of life of the elderly is becoming increasingly important in society. As the physical and mental functions of the elderly decline, they require assistance from others, making it necessary to compare their quality of life based on household types. Therefore, the purpose of this study is to conduct a comparative analysis of the quality of life of the elderly according to different household types. Next, I will talk about the subject. The raw data from the 2020 survey on the status of the elderly was used to analyze it. The analysis used data from 9,790 individuals, including single elderly households, elderly couple households, and elderly households with children. This is the method, data analysis species program. The analysis method conducting descriptive statistics and 1A ANOVA. The subcategories of quality of life consist of health status, economic status, relationship with children, social leisure cultural activities, relationship with friends and community, and overall life satisfaction. This is the result. Among the subcategories of quality of life, health status, economic status, relationship with children, relationship with friends and community, and overall life satisfaction were found to be highest in elderly couple households, followed by elderly households with children and single elderly households. Finally, I will discuss the conclusion. Because there are differences in the quality of life of the elderly depending on household type, it is necessary to reflect this in policymaking for the elderly. Particularly, greater social attention is needed for single elderly households, as they have the lowest quality of life. Thank you for your attention.
Hello, my name is Dan Huang. Today I will present on the effect of compression stockings on balance ability in university students. Compression stockings are useful for improving blood circulation, reducing muscle fatigue, and enhancing neuromuscular control. However, most previous studies have focused on middle-aged women or patients, and there is limited research on healthy young adults. Therefore, this study aims to analyze the effect of compression stockings on the balance abilities of university students in their 20s. This study involved 21 healthy university students from K University. We measured their static and dynamic balance abilities both before and after wearing compression stockings. For static balance ability, we measured the posture sway area and velocity with eyes open and closed for 30 seconds. For dynamic balance, we used the limits of stability test, tilting the body in both directions. Statistical analysis was performed using SPSS. The results showed a significant improvement in static balance with the eyes open condition after wearing compression stockings, as both sway distance and velocity decreased. However, there were no significant changes in dynamic balance. In conclusion, compression stockings can enhance static balance ability, particularly when visual feedback is provided. However, they did not have a significant impact on dynamic balance. Future studies with more diverse populations are needed. Thank you.
Hello, this is Yoon-suk Choi in Gyeongnam College of Information and Technology. I'm gonna talk about the study titled Factors Influencing Academic Achievement of Nursing Students. The contents are as follows. This study aims to provide basic data for the development of programs to increase the academic achievement of nursing students by analyzing the relationship between variables on how their academic stress, nursing professionalism, and quality of life affect their academic achievement. The purpose of this study is to identify the factors affecting academic achievement of nursing students. Data analysis is as follows. The result of this study is as follows. Academic achievement were positively correlated with quality of life, but negatively correlated with academic stress. Factors affecting academic achievement were found to be quality of life, type of class, academic stress, and department selection motivation, and the explanatory power of these variables for academic achievement was 19.1%. Implication. The result of this study, various efforts to improve the quality of life and reduce academic stress are required to improve the academic achievement of nursing students. Thank you for listening.
Hello everyone. I will start poster presentation. I am Professor Ye-won Ma from the Department of Nursing at Gyeongnam University. The title of my presentation is Hand Washing Posture Recognition System based on YOLO V8. Current hand hygiene education methods, such as posters and videos, improve short-term awareness, but have limited impact on long-term behavior change. To address this, our study developed a real-time hand hygiene detection system using advanced deep learning technology. This is a research method. We used hand washing videos from 2018 to 2022 to collect image data of 6 hand washing steps via an image collection system. The YOLO V8 model, known for its real-time detection capability, was trained and tested using an NVIDIA RTX 3090 CPU. The result showed that the YOLO V8 based system achieved over 95% accuracy, outperforming YOLO V5 in detection speed and accuracy. In conclusion, this system effectively monitors hand hygiene motions in real time and can be a valuable tool for infection prevention and hygiene management. This concludes my presentation. Thanks for your attention.
For International Conference, Cardiopulmonary Resuscitation and Performance.
Ability and Persistence of Health College. 24 International Conference, Cardiopulmonary Resuscitation and Performance. Ability and Persistence of Health College. Department of Dental Hygiene, Kyungnan College of Information and Technology, Republic of Korea. Background and purpose. CPR refers to a life-saving act to resuscitate a person with cardiac arrest and consists of a series of processes that provide ventilation and allow voluntary circulation to be restored within a short time. According to a recent study on the number of cardiac arrest cases in Korea, the incidence rate of cardiac arrest per 100,000 people in Korea in 2021 is estimated to be about 64.7. Since cardiac arrest begins irreversible damage to the brain for or 5 minutes after it occurs, CPR by the first person who witnessed cardiac arrest is important to increase the survival rate of cardiac arrest patients. In order to increase the survival rate of cardiac arrest patients, it is important for witnesses to recognize the occurrence of cardiac arrest, start accurate CPR, and effectively use automatic defibrillators, and for this, awareness and education on CPR are required. Therefore, this study was conducted to understand the knowledge and performance of CPR for health college students who have received CPR education and to find out its continuity. Subjects and methods. Among the departments of nursing, dental hygiene, physical therapy, occupational therapy, and clinical pathology at K University in Busan, those who received CPR BLS education were targeted. The final data collection was conducted from November 1st to November 8, 2023. After explaining the purpose of the questionnaire, this study measured the knowledge and performance of CPR of health college students. The higher the score of the 5-point scale table of the performance measurement, the higher the performance was measured. T-test and ANOVA were used to find out the difference in knowledge and performance according to general characteristics. Results. CPR training experience was the most common within 3 to 6 months, with 30% 60 people, and 2 to 8 hours of training was the most common with 70.7% 140 people. The average correct answer rate of CPR knowledge was 71.5%. In other words, they showed high knowledge in defining CPR and confirming consciousness, and low knowledge in how to operate an automatic defibrillator, AED. The performance ability of CPR was 3.59 points. Among the performance questions, checking the patient's consciousness level was the highest at 3.89 points, and you can accurately perform air injection and speed during an artificial hop with an ambu bag was the lowest at 3.17 points. There were statistically significant differences in the degree of CPR performance according to general characteristics in the department P0, 000, last educational experience P0, 000, and educational time P0, 001. Among the departments, the nursing department showed higher performance of CPR than other departments, and in the last educational experience, less than 3 months showed higher performance of CPR than more than 2 years, and more than 8 hours of training showed higher performance of CPR. Conclusion. Repeated education is expected to be necessary to increase the continuity of education on CPR, which is an essential competency of health college students who will be engaged in the medical field.
Hello, nice to meet you. 2024 International Conference. Post presentation, the impact of nursing students' personality and complete coping style on their interpersonal skills. Presenter Park Eui-jung. Purpose. This study was conducted to determine the personality, complete coping style, and the interpersonal ability of nursing students. and to determine the impact of the subject's personality and conflict coping style on interpersonal relationship ability. Method. Data collection was conducted from April 50 to April 23, 2024. Data analysis of the final 184 students was conducted using SPSS. Analysis was conducted using frequency, percentage, t-test, ANOVA, Pearson correlation coefficient, and the multiple regression analysis. Result. The result of analyzing interpersonal skills according to the subject's general characteristics showed significant differences by grade. Personality show a significant difference in residence. The subject's interpersonal ability was positively in relation to personality, and conflict coping style found that there was a negative correlation. The influencing factors that affect of subject interpersonal skills are personality, grade, and type of partner, and explanatory power was 26%. Conclusion. Based on the result of this study, we confirmed the personality and conflict coping methods of nursing students and studied the relationship between their interpersonal skills accordingly, ultimately helping to improve the quality of patient care and their own life satisfaction. There is a need to develop programs that can improve interpersonal skills.
Nice to meet you, everyone. It's a pleasure to be here today. I'm Hwagyung Lee from Gyeongnam University, Korea. I'll be presenting my doctoral research on a dual task fall prevention exercise program and its effects on the elderly. Here are contents. As Korea's population ages rapidly, there is an urgent need for effective intervention to maintain both physical and cognitive function in older adults. But traditional physical therapy often focuses on one aspect, either physical or cognitive. Our research takes a more holistic approach, addressing physical, cognitive, and psychosocial aspects together. We conducted a RCT trial with 38 elderly divided into two groups. Both groups exercised 3 times a week for 15 minutes per session over 8 weeks. The experimental group engaged in a dual task fall prevention exercise program, while the control group did traditional fall prevention exercises. Our program used a progressive overload principle for physical tasks. We started with simple open kinetic chain exercises and gradually increased the difficulty, incorporating more complex movements. For the dual task, we began with simple activities and progressed to more challenging ones like calculation and digit span tasks. Here are the instruments for the measurement. The results were quite remarkable. Let me highlight 3 findings. First, both groups gained over 1 kilogram of skeletal muscle in just 8 weeks, which is pretty impressive given that it typically takes 20 weeks of resistance training to gain this much muscle mass. Second, dual task group in physical function, the strength, SPPB, and balance score went up remarkable. This is a big deal because it's linked to lower risk of falling and better locomotion. Most notably, the dual task group showed significant improvement in cognitive function with K scores increasing from 22 to 25, and also in quality of life and balance confidence. These findings highlight that our dual task program offers a more comprehensive approach to elderly care, improving not only physical but also cognitive and psychosocial functions. It is my contention that this research opens a new avenue for preventive care in physical therapy for our aging population. Thank you for your attention. Thank you.
2024 International Conference post-presentation. The effect of sling exercise on glenohumeral joint range of motion and upper quartile Y balance test in young adult with scapular dyskinesis. Presenters 선미장. Background and purpose. The scapula plays a crucial role in normal shoulder function, and its impairment can lead to scapular dyskinesis, resulting in pain and limit range of motion. Sling exercise are effective in enhancing core stability and improving shoulder function. With most studies focusing on athletics, this study specially aim to evaluate the effect of sling exercise on glenohumeral joint range of motion and upper quartile dynamic balance in adults in their 20s with scapular dyskinesis. Subject. This study involved 21 participants in their 20s enrolled at B University in the Saha district of Busan, who exhibit post-result on the modified scapular assistant test. Exclusions were made for individuals with a history shoulder-related surgery, thus with neurologic condition affecting the upper extremity, and participants who were unable to fully understand the study purpose. Method. This study was conducted with 21 college studies in their 20s who has scapular dyskinesis at a university in Busan. The participants were assessed for shoulder pain, range of motion, and functional disability, and they underwent sling exercise intervention. On a week for 4 weeks, shoulder pain was measured using the numeric pain rating scale. Quick test score while the range of motion was assessed with active force, and functional evaluation was performed using the upper quartile Y balance test. The collected data were analyzed using the SPSS program. Result. Internal rotation inhibit a statistically significant increase post-intervention, while no significant change were observed in exercise rotation. Additionally, the upper quartile Y balance test results demonstrate statistically significant improvement across all the directions, lateral and inferior medial. In particular, there was a more significant increase in the superior medial. Conclusion. Scapular dyskinesis show glenohumeral joint internal rotation deficit and decrease in shoulder dynamic balance ability. The 4 weeks shoulder joint sling exercise promoted stability of the shoulder dynamic balance ability. In addition, it made a positive change in the quick dash score. Therefore, a sling exercise that provides shoulder stability and mobility to subject with shoulder bone dysfunction is recommended.
2024 International Conference poster presentation. The title is Effect of Kinesiotaping, an exercise program on a dynamic balance on unstable support surface in adults in their 20s who frequently experience ankle sprain. Background and purpose. Ankle sprains are a common issue, with 10 to 15% of individuals experiencing pain or injury. Kinesiotaping is widely used for ankle injury prevention and treatment. Chronic ankle instability can affect not only the ankle but also the hip joint, suggesting that hip muscle strength exercise may improve CAI. This study aims to explore the effects of kinesiotaping and the exercise program on dynamic balance in individuals who frequently experience ankle sprain. Subject. The study included adults in their 20s who had experienced ankle instability within the past 6 months. The Cumberland ankle instability tool was used to assess ankle instability with a score of 24 or below, defining CAI. Meadow. Subjects were divided into 3 groups. Group A measured after kinesiotaping. Group B, kinesiotaping and ankle stabilization exercise. Group C, kinesiotaping, hip stabilization exercise. The study is expected to show that the combination of kinesiotaping and exercise program improves dynamic balance, with hip stabilization exercise being more effective than ankle stabilization exercise. Conclusion. This research aimed to provide basic data for exercise program targeting CAI patients, suggesting that hip stabilization exercise combined with kinesiotaping may offer superior result in improving dynamic balance. Thank you.
Hello, this is Chung Moo Park in Dong University. Today I'm going to talk about a clinical trial for skin moisturizing and calming ability of shed mask containing seaweed composite extract. Based on the result of cytotoxicity and antioxidant activity among seaweeds known to have skin whitening and calming abilities, it was prepared the seaweed composite extract and the prototype of shed mask. In this study, it was estimated that the skin calming and moisturizing abilities of shed mask containing seaweed composite extract, and then tried to manufacture the prototype of the product. After IRB approval, all participants were divided into 4 groups as follows: prototype product group, commercial product group A, B, and C. Before and after the experiment, skin condition was measured using a professional skin measuring instrument, STM, focused on oil, moisture, and skin elasticity, and the survey was also performed. 4 weeks later, the oil amount of skin decreased by 352.5 points in the experimental group, 359.5 points in the control group A, 355.4 points in control group B, and 13.2 points in control group C. The amount of moisture was increased by 7.3 points, control group A by 0.3 points, control group B by 3.6 points below 0, and control group C by 1.7 points. The elasticity was increased by 3.5 points in the experimental group, 0.5 points in control group A, 9.4 points below 0 in control group B, and 6.2 points in control group. As a result, the experimental group exhibited good points in moisture and elasticity, so it might be used as a new functional material for cosmetics. Thank you for listening. Hello, this is Chung Moo Park in Dong University. Today, I'm going to talk about inhibitory effect of lycopene against TGF-beta-induced MMP9 expression in YD10B oral squamous carcinoma cell line. Lycopene, an abundant carotenoid in tomatoes, has been known for its preventive activities against diverse oral diseases, including precancerous lesions, oral leukoplakia, and oral submucous fibrosis. In this study, the inhibitory effect of lycopene against the expression of matrix metalloproteins 9 one of the essential enzymes for the degradation of extracellular matrix. In transforming growth factor beta-induced oral squamous carcinoma cell line YD10B to determine the capacity of lycopene against MMP9-initiated rearrangement of tumor microenvironment in oral cavity. Cytotoxic effect of lycopene was analyzed by WST1 assay, and protein expression level of MMP9 and snail were estimated by Western blot analysis. Highly induced MMP9 expression was detected in TZ-beta treated YD10B cells. Lycopene treatment significantly inhibited MMP9 expression in a dose-dependent manner. In addition, TZ-beta treatment induced snail expression, the transcription factor for MMP9, which was also significantly attenuated by lycopene treatment. Lycopene inhibited TZ-beta-induced MMP9 expression through the attenuation of the transcription factor snail expression in YD10B cells. This study suggests that lycopene might be a candidate for the effective agent to mitigate the construction of tumor microenvironment in oral squamous carcinoma. In addition, the exact molecular mechanism of MMP9 induction must be elucidated in the future study. Thank you for listening. Hello, this is Jung-Moo Park in Dongyi University. Today, I'm going to talk about the antibacterial activity of clove bud essential oil against both Streptococcus mutans and Porphyromonas gingivalis. Among various oral pathogens, both Streptococcus mutans and Porphyromonas gingivalis are closely related to the initiation and progression of periodontal diseases. Syzygium aromaticum, also known as a clove bud, has exhibited a potent sterilization effect, and its main constituents, eugenol, is widely used in dentistry to treat toothache and purpitis. Although various biological activities of clove bud essential oil, called for CBEO, such as analgesic effects, stress relief, and antiviral effects, has reported, as antibacterial activity against both oral pathogens as mutans and P. gingivalis has not been exactly analyzed. The minimum inhibition concentration and the growth inhibition effect of CBEO against both pathogens were estimated and tried to evaluate its potential ingredients for the prevention and treatment of various oral diseases. CBEO was diluted in DMSO, and the final concentration was 10, 15, 20, and 30%. The MIC was determined in the concentration of 0, 0.3, 0.7, 1.53, 6.25, and 20.5%. The growth inhibition zone was determined by the disc diffusion method. All experiments were repeated 3 times. The MIC of S mutants in CBEO was 0.7 and P. gingivalis was 0.5%, which indicates that the MIC was lower in S mutants than that of P. gingivalis. In S mutants, the result of this diffusion method showed 21.6 millimeters and 10%, 24.6 millimeters and 15%, 25.6 millimeters and 20%, and 28.9 millimeters and 30%. In P. gingivalis, CBEO was also inhibited by 16.6 millimeters in 10%, 19.6 millimeters in 15%, 21.6 millimeters in 20%, and 24.4 millimeters in 30%. Although CBEO exhibited potent antibacterial activity in both pathogens, S mutans was more sensitively affected by CBEO treatment than that of P. gingivalis. CBEO showed potent antibacterial activity against S mutants and P. gingivalis. Therefore, CBEO might be a potential candidate that is utilized as a preventive and therapeutic composition for children and adolescents who are exposed to the high risk of dental caries. Thank you for listening.